Mr. Wang. I'm so worried about my son's medicine.
Oh, okay, I see. You could have your seat first.
Thank you.
Hello, my name is Vicky. I'm your pharmacist today. And how can I help you?
The thing is that my son is suffering from fatalism, and I noticed the caution that the patient with G6PD deficiency should avoid this medicine.
Oh, yes, I see. Okay. Well, first of all, I want to ask you some questions about your son to make sure his profile is correct, and I could give you the right recommendation. So, okay, how old is he?
It's 1 year old.
Okay, and his birth date is right?
Yes.
Oh, okay, thank you. Well, okay. Okay, well, following the consulting will need about 10 more minutes. Is that okay for you?
Yes.
Okay. And then, is there any other medication that your son takes currently?
No, I think just
this?
yeah, just this medicine we got from yesterday.
Okay. Oh, and besides the GLP deficiency of your son, is he has any other disease or some drug allergy?
So far, no. I think just only this.
Oh, only this. Okay, I see. Okay, so do you know why the doctor used this kind of drug for your son?
Yesterday he told us because my son's having crying all day, and the diagnosis is the solar throat.
Oh,
Yes.
yes. Okay, so you know how to use it, right? When do you take the drug you know how to use?
Actually, because it's my father taking care of my son, so I don't know if they use it correctly. So yeah.
Okay. Oh, I think you need to tell the right way and the right dosage for your grandfather. It's really important. And so, when you take your son to the doctor, did you tell doctor that your son has this kind of GLP deficiency?
No, we forgot.
Oh, you forgot. Okay. Well, it's pretty lucky that ibuprofen is not the high-risk drug for GLP deficiency.
Okay.
So, and I see his weight is about 8 kilograms,
Yes.
and the doctor prescribed about 4 cc for him. And it's also lucky that the dosage is in the safe dose. So
Okay.
I think you could use this without nervousness.
Okay.
But next time, I advise that you need to tell doctor, anytime when you bring your son to the doctor, you need to tell them that your son has pharmacy. Because it is important. If the doctor didn't know, maybe next time if the doctor use the aspirin, and it will be dangerous for your son.
So aspirin is a medicine my son should be avoid.
No. Yeah. It's one of the drugs your son needs to avoid. Okay, and next, and although you can use this drug, but if your son, after using this drug, if your son appeared like jaunty, his skin appeared yellow, or his face turned pale, or feel tiredness, or even coma, you need to just stop using this drug and take your son to see the doctor.
Okay.
And do you know this GLP deficiency well? And do you know how to take care of your son?
No. Can you give me some suggestions?
Oh, okay. Well, when you need to take care of this kind of child, you need to avoid to use the mothball in your house.
What is mothball?
It's something that contains camphor, artificial camphor.
Okay.
You need to avoid something that contains artificial camphor, menthol, or even the not valve.
Okay.
Yeah. And second, you can't feed your son with fava beans.
Okay.
Yeah, the second. And third, when your son got hurt, you can't use the crystal violet.
Okay.
Yeah. Okay, and then fourth, when your son got sick, you have better to bring your son to see a doctor and and not to buy just buy drug without doctor's prescription. Yeah, prescription,
Okay.
because there's many drugs that will induce severe acute hemolysis.
Okay.
Yeah, and it's really important. And then 5, just like I say, next time or in the future when you bring your son to the doctor, you always need to tell them your son has this kind of disease, and if you have, and if he has any symptoms like I say just jaundice or pale or tiredness, you should just bring him to the doctor.
Okay, so do you know, is there any antibiotics that my son should avoid?
Oh yeah, like sulfa drugs, you know,
Okay,
sulfa he can use, and quinine.
Cleaning.
Yeah, and just like I said, aspirin also need to also include the drugs that include aspirin. You all can use.
Okay.
And I think just normally like that. If there's other drugs, you need to ask the doctor first.
Okay.
Okay. And do you know any other? Do you have any other question, or do you know how to take care of your child when he uses the drugs?
I don't know.
You don't know. Okay. Okay. Let me provide some tips for you.
Okay.
First is when next time when you take this pocket insert, you'll do really better because you see this caution.
Yes.
So next time when you take it, anytime when you need to give your son this drug, you need to see this caution first. It's very well. And second, you need to know the right way to feed your son, and you need to see clearly of the dosage and the dosing frequency. It's
Okay.
also important, and you can't just overuse it or something.
Okay.
Yeah. Okay. Then third, be alert when your child with severe adverse effect or something allergic reaction, and you should just record it and maybe bring your son to the doctor. And then fourth, just like I say, because your son has GLP deficiency, and you should not just buy the drug by yourself or even some herbal products, because maybe something will also affect your son.
Okay.
Then fifth, always use the water with drug without using milk or juice.
Okay. But these medicines already liquid.
Yes.
So can I mix with other liquid?
I think you just mix with water is better. Yeah, only take with water.
Okay.
Yeah.
So do you know is the fibrosis a curable disease?
What? One more time?
I mean, is this disease
Yes.
curable?
No.
No.
Well, this is well following in his whole life, but
Okay.
it can be prevented by just you don't touch the things I just tell, like camphor, menthol, or something like crystal violet, or something, some drugs used before you should ask doctor. And yeah, also you can feed him fava beans. I
Okay.
think
Yeah.
when he just grew up, you could just tell his teachers or his classmates to help him to avoid to touch these things. Then
Okay.
it could stay well,
Okay.
like normal person.
Okay. So when I get home, I can feed my son these
Yes.
medicines.
Yes.
Okay. I think that's it. Okay. Okay. Thank you so much.
Thank you.